heard about the Aramis study today in the setting of M0 castrate-resistant prostate cancer. That's a condition I'm not actually sure even exists, but it's one that's been studied extensively now. We've got 2 approved agents in the form of enzalutamide and apalutamide, and now we've heard about darolutamide as well. All of these studies have used metastasis-free survival as the primary endpoint of these studies, and this is now an FDA registrable endpoint, so it's a reasonable approach for the company to take. One of the points of distinction about Aramis was the use of darolutamide. This is a drug with a novel structure and potentially a different side effect profile. The earlier studies showed efficacy and favourable toxicity, and so it was logical to take it into this situation as well. The findings of the study showed once again that use of darolutamide was superior to placebo in terms of the primary endpoint of metastasis-free survival. There are various other endpoints that were also positive in the study, and as hoped, the toxicity profile looked to be quite promising. At the moment, we don't really have any way of distinguishing these 3 agents from each other. They work through a very similar mechanism of action. I suspect it'll come down to marketing issues, to pricing, and perhaps to toxicity. We've heard today in the meeting a lot more insight into the issues around patient-reported outcomes and cost-effectiveness, and I think that these are going to become much more important issues for the United States and other countries to continue as it starts to make decisions about which of these sorts of agents should be in routine use. One of the reasons darolutamide was studied was because of the potential differences in the side effect profile. Enzalutamide, when it first came out, seemed to be a very benign drug, but we're now recognising that there are some more subtle issues in terms of toxicity with this agent. Things that were not necessarily recognised as being related to the drug, like falls, for example, cognitive impairment, memory impairment. These, for some men, become very significant problems. Apalutamide, which has also been approved for this indication, seems to have less of those sorts of toxicities. They've never been compared head-to-head directly, of course. And now we have darolutamide, which has been shown to have much less penetration of the blood-brain barrier, and again a toxicity profile that seems to be more favourable. So it may well be that if these drugs are equivalent in efficacy and we have one or more of them that has an improved side effect profile, that they may end up being the preferred agents.